first question. Can you explain how the Discovery Hospital at Home model differs from traditional hospitalization, and what inspired you to pursue this initiative approach to patient care?
So thank you. I think the most important thing is that virtual healthcare is something that it's not new, but it is gaining more and more traction in South Africa as it has around the world. Our business does a lot of the back end work for Discovery virtual healthcare, of which Hospital at Home is a part of that. And we have partnered with Discovery to deliver the medical services in both monitoring and admitting doctors to the Hospital at Home program. Hospital at Home in itself is also not new. It's very successful in many parts of Europe and the US. And we believe that it answers so many questions to hospitalization that where there's a definite need for patients to be admitted to hospital in certain circumstances, there are other circumstances where it's much more effective to be admitted at home. The monitoring that can be done at home is now very effective with the new devices that are available and the technology. And the ability to recover at home has been proven for specific types of cases to be much more effective. You know, you get away from things like hospital-acquired infections. You can enjoy the food that you prepare at home and not necessarily look forward to in hospital food. And you can get all the same services delivered to you in the form of nursing or physio or medicines or emergency care. So it makes all the sense in the world to be part of this new initiative in South Africa, primarily with Discovery, but now there's several other players in the marketplace that are developing hospital at home projects.
What specific criteria must patients meet to qualify for the Hospital at Home program, and how do you ensure that they receive the necessary support and resources in their home environment?
So each different player in the hospital at home market has slightly different criteria. Specifically with regards to Discovery, there are 8 conditions that have been promoted as being very suitable conditions to be admitted in hospital at home. And those have been researched and well documented as showing benefit. Most of them are simple medical conditions that require limited nursing intervention. So things like asthma, some of the respiratory conditions, a mild pneumonia, cellulitis, exacerbations of COPD, chronic obstructive airways disease, and there are a couple of others which I can't think about off the top of my head. What is becoming evident, though, is that as the monitoring technology gets better and better, that spectrum of patients that can be admitted safely into home will grow. And patients that are being admitted for observation are particularly good candidates, potentially after head injuries or with viral illnesses that are usually self-limiting, where those patients ordinarily would have been admitted in hospital and monitored in hospital can now be admitted at home and monitored at home. Most of the benefit originates through the monitoring process. So the monitoring process entails having a device connected to your wrist, to your arm, to your chest, that transmits through to a central call center that is monitored by nurses and doctors primarily. And that monitoring information is generally in real time and is much more consistent than in-hospital monitoring. So you're able to watch trends much more accurately in the monitoring environment than you are in a hospital environment. And that looks or allows for us to be able to look for trends in either deteriorating or improving circumstances and then act accordingly, whether we need to send more help or transfer that patient into a hospital environment, or whether in fact we continue to watch the improvement of that patient. So it's the monitoring that's key, and the monitoring is so good with the new technology that it makes hospital at home very safe.
How do advanced monitoring technologies such as wearable devices enhance patient care within the hospital at home model? And what role do they play in ensuring patient safety and timely interventions?
So it talks to the technology that is available now, and it is evolving. I want to say almost daily at the moment. There is so much new technology becoming available. The devices that are currently in use now in the hospital at home program enable the monitoring of blood pressure, pulse, respiratory rate, temperature, oxygen saturations, movement. So you can know if someone's had a fall or got out of bed. Um, those monitoring devices transmit usually through a cellular signal directly into a call center that is active 24 hours a day and monitoring the trends of each individual patient. And those trends are looked at and acted upon by the doctors in the monitoring center to be able to then say what needs to be done. Sometimes there's nothing that needs to be done. Sometimes care needs to be escalated, either in the form of sending a nurse or sending a paramedic or returning that person to hospital, or alternatively, sending someone to the home that is able to then do a dressing, provide an additional medication. And all this is done in conjunction with an overseeing medical professional, usually a specialist physician or a specialist emergency physician or even a surgeon, depending on the type of case. And they oversee the care and are constantly in contact with the monitoring doctor and do regular ward rounds or consultations virtually with the patient. So it's a very well observed patient that provides the safety net to hospital at home as a method of care.
In your experience, what feedback have you received from patients and healthcare professionals regarding the comfort and effectiveness of receiving hospital level care at home, and how do you see this model evolving in the future?
So the feedback from patients is absolutely fantastic. Patients love it. They can recover in their own bed, in their own home, with their own devices, their own music, their own television, their own friends and family around. And that in itself creates a wonderful healing environment for patients. They love it, and they generally do very, very well. And the hospital at home admissions tend to be shorter than the in-hospital admissions for those particular reasons. Um, a lot of doctors are still questioning the efficacy, but this, in my experience, is something that doctors do because as doctors, we are trained to have evidence of improved healthcare, not just observational evidence, but evidence that is scientifically proven over long periods of time. So whenever you introduce something new, there's going to be an element of skepticism that doctors always will have. Um, Interestingly, if you look at the non-clinical aspects of hospital at home, the doctors and the hospitals or the participants in the process have a very similar earning potential that they would if the patient was at home. So there's no perverse incentive either way for doctors to admit into hospital or into hospital at home. It's really governed by the improvement in patient safety and the improvement in patient outcomes, ultimately, that delivers the better patient care in hospital at home for the right type of case. And I must emphasize, for the right type of case. So doctors are inherently skeptical of new technology. We've seen it in all aspects of virtual healthcare, but we also see it in all aspects of new devices, new procedures. It's just the nature of the doctor to be conservative in their approach. And I think this will gradually become adopted more and more in the South African context as people realize the benefits, the safety, and the ultimate cost saving that comes with it in what is a really constrained healthcare environment in the country.